Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. Previously introduced, my name is Aulia Ramadhani Rambe, grade 1D in the morning, majoring in elementary school teacher education. This morning, I'm going to talk to you about COVID-19. I'm giving a little information about COVID-19 and to invite to always maintain health and cleanliness, starting from our own habits. I've divided my presentation into several parts. Part 1, discuss about COVID-19. As you know, what is it COVID-19? COVID-19 is a disease caused by the severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 virus. COVID-19 can cause respiratory system disorders ranging from mild symptoms such as flu to lung infection such as pneumonia. The first case of this disease occurred in the city of Wuhan, China at the end of December 2019. After that, COVID-19 spread between people very quickly and spread to dozens of countries, including Indonesia, in just a few months. Its rapid spread has led several countries to implement policy to impose lockdowns to prevent the spread of the coronavirus. In Indonesia, the government has implemented a large-scale social restoration or PSBB policy to suppress the spread of the virus. Part 2, discuss death rate due to COVID-19. Death rate due to COVID-19 according to data released by the Task Force for the Acceleration of Ending of COVID-19 of the Republic of Indonesia. The number of confirmed positive cases until January 2021 is 927.380 with a death toll of 26.590. From these two numbers, it can be concluded that the case fatality rate or death rate caused by COVID-19 in Indonesia is around 2,9%. The case fatality rate is the percent of the number of deaths from the total number of confirmed and reported positive cases of COVID-19. Part 3, discuss cause of COVID-19. COVID-19 is caused by SARS-CoV-2, which is a new type of virus from the coronavirus, or a group of viruses that infects the respiratory system. Coronavirus infection can cause mild to moderate respiratory infections such as flu or infection of the respiratory system and lungs such as pneumonia. COVID-19 was originally transmitted from animals to humans. After that, it was known that this infection can also be transmitted from human to human. Transmission can be through the following ways. 1. Accidentally inhaling the saliva or drop that comes out when a person with COVID-19 sneezes or coughs. 2. Holding mouth, nose, or eyes without washing hands first after touching objects affected by droplets with COVID-19. 3. Close contact or less than 2 meters with people with COVID-19 without wearing a mask. Part 4, discuss symptoms of COVID-19. Early symptoms of COVID-19 infection can resemble flu symptoms, namely fever, runny nose, dry cough, sore throat, and headaches. After that, the symptoms might disappear and heal or even get worse. Patients with severe symptoms might experience fever, cough with phlegm or bleeding, shortness of breath, and chest pain. The symptoms mentioned above appear when the body reacts against the COVID-19 virus. In general, there are 3 general symptoms that can indicate a person is infected with COVID-19, namely 1. Fever or body temperature above 38 derajat Celsius, dry cough, hard to breathe. In addition to the above symptoms, there are several other symptoms that are rare but can also appear in COVID-19 infection, namely 1. Tiring easily, 2. Muscle ache, 3. Chest pain, 4. Sore throat, 5. Headache, 6. Nose or vomiting, 7. Diarrhea, 8. Runny nose or stuffy nose, 9. Shivering, 10. Sneezing, 11. Loss of taste ability, 12. Loss of smell or anosmia. Symptoms of COVID-19 can appear within 2 days, 2 weeks after a person in infection with the virus that causes it. Some COVID-19 patients also experience decreased oxygen without any symptoms. This condition is called happy hypoxia. In addition, several reports also state that some COVID-19 patients can experience skin rashes. To determine whether the symptoms are symptoms of the coronavirus, a rapid test or PCR is needed. To find a place to do a rapid test or PCR near your home. In some sufferers, COVID-19 can cause no symptoms at all. People who have been confirmed positive for COVID-19 through RT-PCR examination but do not experience symptoms are referred to as asymptomatic confirmation cases. These sufferers can still transmit COVID-19 to other people. In July 2020, the Ministry of Health of the Republic of Indonesia replaced the old operational terms for COVID-19, such as ODP, PDP, OTG, into new terms, namely suspect, probability, and confirmation. Part 5. Prevention COVID-19. Currently, Indonesia is regularly vaccinating the people of Indonesia for COVID-19. Even though vaccination have started to be carried out, the best preventive way is to avoid the factors that can cause you to be infection with this virus, namely 1. Apply physical distancing, which is to maintain a minimum distance of 2 meters from other people, and don't go outside the house first unless there is an urgent need. 2. Use a mask when doing activities in public places or crowds, including when you go grocery shopping. 3. Routinely wash your hands with soap and water or hand sanitizer that contains at least 60% alcohol, especially after doing activities outside the home or in public places. 4. Do not touch your eyes, mouth, and nose before washing your hands. 5. Increase endurance with a healthy lifestyle. 6. Avoid contact with sufferers of COVID-19, people who are suspect of being positive for COVID-19, or people who are sick with fever, cough, or runny nose. 7. Cover mouth and nose with a tissue when coughing or sneezing, then throw the tissue in the trash. 8. Keep clean objects that are often touched and the cleanliness of the environment, including cleanliness of the house. For people who are suspect of being exposed to COVID-19, including the suspect and probably categories previously referred to as ODP, person under monitoring, or PDP, patient under surveillance, there are several steps that can be taken so as not to transmit the coronavirus to other people, namely 1. Do self-isolation by living in separate room from other people for a while. If this is not possible, use a different bedroom and bathroom that those used by other people. 2. Take medicine recommended by your doctor. 3. Take temperature measurements 2 times a day, morning and evening. 4. Do not leave the house except to get treatment. 5. If you want to go to the hospital when your symptoms get worse, you should first contact the hospital to pick you up. 6. Forbid and prevent others from visiting you until you are completely cured. 7. As much as possible, do not have meetings with people who are sick. 8. Avoid sharing eating and drinking utensils, toiletries, and sleeping equipment with other people. 9. Wear a mask and gloves when you have to be in a public place, such as a hospital or with other people. 10. Use a tissue to cover your mouth and nose when coughing or sneezing, then immediately throw the tissue in the trash. Conditions that require immediate treatment by a doctor in hospital, such as childbirth, surgery, dialysis, or vaccination of children, need to be handled differently with some adjustment during the COVID-19 pandemic. The aim is to prevent transmission of COVID-19 while you are in the hospital. Consult with your doctor about the best action that needs to be done.
Okay, thank you for listening to me faithfully. I hope that the information I convey can be useful for you and add a little insight. More and less, I apologize. I'm done. Wabillahi taufiq walhidayah. Wassalamualaikum warahmatullahi wabarakatuh.